Right.
Yeah, go up.
Yeah. So my name is Yvonne Otchere, like you all know. I'm the CEO of PsycCare, and basically what we do is that we are into women's health advocacy, and we support breast cancer patients as well. Basically, I'm a psychologist by profession, and a lecturer as well. I love to teach than to practice. So basically the passion is around building support for women with experienced cancer cases, basically. Yeah.
All right, I will go next. So my name is Juliet Quansah. I'm a medical oncologist and hematologist. I take care of cancer patients basically, and I'm also the founder of Cancer Support Network of Ghana, which is aimed to support patients that have been diagnosed with cancer and their family. I'm glad to be here.
Yeah, thank you for joining us. Eric.
Yes, Yvonne.
Please, can you give us a brief introduction of yourself?
Right. My name is Eric Brobbey. I'm a trained psychiatric nurse, but now practice as an oncology nurse at the Kolebu Teaching Hospital. I head the chemotherapy unit at the surgical department. I joined a number of NGOs to promote support for cancer patients. Noticeable among them is Cancer Support Network, which my Igbo founder is on call. And I happen to be the unapproved vice president of the Cancer Support Network.
Very
hoping to get the approval very soon. I'm also the secretary to the publicity committee of Breast Society of Ghana.
Right.
And I do a number of advocacies. Yes, and I love helping patients. I love helping people, to go through treatment as well.
Okay. Thank you for that brief introduction. Bruwaa. Okay, so we have Bruwaa on the line. Bruwaa, can you give us a brief introduction? Or Rita as well. So we have our clinical psychologist from the breast unit with us as well. And then we have Bruwaa Adomako with us as well. We'll start with the first session, which basically would look at perinatal mental health and breast cancer, or chronic diseases among women. And I have an expert here with us who has done some field work on perinatal mental health. She's actually Dr. Bruwaa Adomako Agyekum. She would actually give us a brief presentation on perinatal mental health and give us an understanding of how, that process of perinatal mental health is linked with chronic diseases among women, and especially. So Bruwaa, are you here? Yeah, I can see Bruwaa is here. Bruwaa, are you ready? If you can hear me, just go on with your presentation.
Does she have PowerPoint or no? Because if she have PowerPoint, we have to make her the host to be able to share her slides.
Okay, all right. I think she has PowerPoint. Okay.
Is she on? I think she's muted.
Okay, did we mute? We didn't mute her.
No, I think she muted herself. She should unmute herself and let us know if we need to make her the host.
Oh, hello, everyone. Yeah, my name is Bruwaa Adomako Agyekum. It's good to be here and to be able to share the small knowledge I have with all of you. It's supposed to be a very short presentation to just give you an overview of perinatal mental health issues, and to see if there are any relationships at all with chronic diseases, as Dr. Otchere has said. So I'll just go on. Just give me a few minutes of your time. So when we talk about perinatal mental health, we are talking about the health and well-being of a woman during the time of pregnancy to 1 year after birth. It's quite specific. So the mental health and well-being of the woman from the time of conception, so during pregnancy to 1 year after birth. And when we talk about perinatal mental health problems, we are talking about some of the disorders, the difficulties, and the challenges, the mental health challenges that women encounter during this period. And so we are talking about depression or depressive disorders, or you could say perinatal depression. We are talking about anxiety. We're talking about eating disorders, obsessive compulsive disorders, post-traumatic stress disorders, and etc., that people face during the period of pregnancy to 1 year after birth. Some of the risk factors or some of the things that cause people to encounter such mental health difficulties are, it's a myriad of factors. So we have biological factors, sometimes the fluctuations of the hormones during pregnancy and after birth. Some people are sensitive to some of these fluctuations, and it predisposes people to experience some of these mental health difficulties, especially after childbirth, where the withdrawal of some of the reproductive hormones like estrogen and progesterone are so sharp. Some of these reproductive hormones are secreted during pregnancy. They reach very high levels in order to be able to sustain the pregnancy. And then shortly after one has a baby, those hormones, drop drastically because the reason why they are there, it's no longer effective. And so that sharp withdrawal, some women are sensitive to those fluctuations, and it can predispose them to perinatal mental health problems. Other causal factors are having a history of mental health problems prior to being pregnant. So if you have a history of depression, have a history of anxiety, and then you are more prone to either develop them again, or they become worse, they become exacerbated during the pregnancy period or during the postnatal period. Also, having low social support. So if you don't have a lot of practical or emotional support during the pregnancy or the postpartum period, and you are alone, you don't have someone to help you take care of the baby, you don't have anybody to talk to, because this period can be very overwhelming, the emotions during this period are very intense. And so you need help in one way or the other, either practically or emotionally, and that has been found to have a buffer effect against having perinatal mental health problems. If you have an unplanned for pregnancy, you're not expecting to be pregnant, and then all of a sudden you find yourself pregnant, and it seems there is no way out, you're kind of stuck, then it could give you mental health problems, especially you start thinking about it. How am I going to cope? If you have children already, how am I going to cope with this child in addition to the other children I have? It's more exacerbated in resource constrained settings. So if you don't have a job, you have low income, then you are more likely to develop these kinds of problems. If you have a low support from your intimate partner, that is a major factor for developing perinatal mental health problems. So if your husband or your partner, whoever is not supportive enough, does not show you the love, the care, the attention that you need during this period, then it is a very major risk factor for developing perinatal mental health problems. And the list goes on and on. Whatever becomes stressful for the individual during this period is likely to trigger these kinds of perinatal mental health problems. The effects of these problems are myriad, especially for the woman, for the child, for the husband, for the family. And for the woman herself, it has been found that suicide as a result of bad mental health, as a result of poor mental health, is one of the major, or is the major cause of mortality within this period. So when they talk about maternal mortality, we are not talking only about physical causes in the hospital, negligence or having lack of a trained personnel or bleeding, but suicide has been estimated to be the major cause of mortality, the number one cause of mortality during this period. But in our parts of the world, we don't pay much attention to these kinds of issues because of a number of reasons. The stigma attached to reporting somebody died of suicide. Our reporting systems are defective, and so we don't keep accurate records, and so we fail to appreciate these kinds of linkages. And also, women who, if you are depressed, you are less likely to take care of yourself. You are less, during pregnancy and after birth, you are less likely to adhere to your medical care regimen. So if you are supposed to take some kind of medication, if you are supposed to exercise, if you are supposed to behave in a certain way that would give positive benefits to you and your child, you are less likely to do so, like maybe taking your folic acid. You know, you are depressed, you couldn't care less. You are less likely to eat nutritious meals because you just can't muster up the energy to, you feel hopeless. So you think, well, what's this going to do anyway? So you are less likely to eat nutritious meals, and that's going to have an effect on you, your health, as well as the health of the baby in utero. You are more likely to engage in risky behaviors such as smoking, such as engagement in illicit sexual affairs. That is going to predispose you to sexually transmitted diseases, and that's going to increase your likelihood of having infections that are going to have an adverse effect on you as well as your child. So you are more likely to have a premature birth because you are over-secreting stress hormones, which sometimes cause premature labor. You are not eating well, you're not taking care of yourself, and so the baby can have a failure to thrive. The baby is not growing well, be born with a low birth weight, and low birth weight is one of the key indicators for infant mortality and child mortality. I mean, so apart from these, also when the baby is born, the maternal sensitivity is reduced. That means that the face-to-face time and interaction that the mother is supposed to have with the baby is reduced, because the mother who is depressed is less likely to sing to the baby, to play with the baby, to look at the baby's face, to display appropriate facial interactions with the baby. And all these stimulate the baby's cognitive development, social development, as well as emotional development. So if the mother is not giving the appropriate stimuli, then there are going to be deficits in the child's response mechanisms. And this is going to delay the child as far as the motor development is concerned, in terms of speech development, in terms of cognitive and behavioral and social development. And so the repercussions of perinatal mental health problems have been shown to last even up to adolescence, predisposing the child to developing mental health problems themselves, depression, as well as anxiety themselves, and the effects go even up to adulthood. Also, some of the effects of perinatal mental health problems include more bouts of diarrhea, because you're not taking care of the baby well, you're not giving the baby the appropriate care that they need. More hospitalizations for the baby, so the baby is more prone to get sick and be admitted in the hospital, especially within the first month. And also failure to adhere to the immunization schedules. So most parents, most mothers who have perinatal mental health problems have failed to go by or complete the immunization schedules, as well as fail to breastfeed appropriately and for the length of time that is required, because they just cannot keep up with the physical toll of breastfeeding. Apart from the effect on the child, perinatal mental health problems also affect partners. So if a woman has a perinatal mental health problems, there's a 50% chance that her husband will also suffer from perinatal mental health problems, and that's how serious it is. So if a woman is depressed, it's more likely that her husband is also depressed. And if there are other children in the house, that means that they are also lacking from the emotional involvement of both parents, and it's going to have an effect on them. It has cost on society as well, and so on and so forth. And in other jurisdictions, actually the cost of perinatal mental health to the economy has been quantified, and you can have, there's a figure attached to it. And so that would ram the point home that this issue is very important, because of the effect on both the mother and the child, and also by extension the husband. Everybody is affected and is affected negatively, and the impact is very strong and serious and long lasting. And so there must be appropriate care and attention that must be paid to this period. In terms of the linkages between perinatal mental health and chronic diseases, it seems that generally, if you have poor mental health, you are more likely to have poor physical health. And you have poor physical health, you are more likely to have poor mental health. So that mind and body, symbiotic relationship is already established. And so that would be the premise from where I would say that it's very important, especially for younger women, to take care of their mental health and give proper attention to their mental health, because inadvertently if you have poor mental health, if you are stressed up, you are depressed, it predisposes you to develop certain kinds of chronic diseases that would be bad for your health. In speaking of pregnancy, the research though states that pregnancy seems to have a protective effect on against breast cancer. The research is still out there. There are various views, some for and some against, and there is no identified linkage that one could say that one could stand on. But the research presupposes that pregnancy offers a protective effect against breast cancer, and also breastfeeding seems to offer some protective effects against breast cancer. So breastfeeding should be supported in women young women who have babies, because it seems to have some protective effects against breast cancer. And I think that in taking care of our mental health in general, we should make sure that our social support systems are intact, make sure that you have people around you who can give you both practical and emotional support. And that is very important to your mental health. And that has been shown to be a key buffer against developing chronic diseases. Take things at your pace. Don't try to be a superwoman or superman trying to do everything by yourself. Pace yourself and take things one after the other, and make sure that you are in your comfort zone as far as scheduling activities are concerned. And also have self-compassion, congratulate yourself, give yourself a pat on the back, and recognize all the effort you are putting in, and be your number one, your own number one cheerleader. So I think in a nutshell, that's what I would say. Yvonne, Doc.
Bruwaa, thank you for that excellent presentation. I want to have an understanding of correlations between BC and perinatal mental health. And would you say from your studies that there's a very strong relationship, or you think that it's still within the purview of poor mental health and its rippling effect on chronic diseases among women?
Okay, from the literature so far, there is no, or from what I have seen, there is no direct relationship between perinatal mental health and chronic breast cancer, other than the fact that if you have a lot of stress, you are secreting a lot of stress hormones, and that lowers your body's immune system and leaves your body open for opportunistic infections. So if your body is always flooded with cortisol, it's going to have a negative effect on your body. It weakens your body's immune system and opens it up. So any kind of disease, is more likely to be able to thrive within your body. However, in terms of pregnancy, the research seems to say that pregnancy has a protective effect on women as far as breast cancer is concerned, and breastfeeding as well cuts the risk of breast cancer significantly for women within the reproductive years.
Right. Thank you very much, Bruwaa. Expert in perinatal mental health and an advocate as well. Thank you so much for that presentation. So we would want to move to our next question.
You're welcome, Doc.
Yeah, thank you so much. We want to move to our next topic that will look at hindrances to breast cancer fight in Ghana. I know Juliet has a lot to say because she's been at the forefront of this whole conversation, and I would be happy to have her broaden it up to the cancer fight as well, basically looking at some new trends to treatment, and then public health education as well. What should we be looking at? Is the conversation a bit skewed, or there are some basic safeguards that we can bring in to help structure the conversation? So Juliet, are you in there? Hello, Juliet.
Yes, I'm here. Sorry.